Hi, and welcome today to the GAPS Lessons Learned Prototypes of 2023 webinar. Pat and I are delighted to have you here today. We want to tell you that all the work today is inspired and led by the community. Pat Kappa and I, who are the project directors, our job is really to take the information that we've learned and take the ideas from the community and test them and put them into action in a prototype. So that's what we're going to do. We're going to talk about all those prototypes today. Just a couple of housekeeping things. We'll use the chat for a lot of things. This is a really jam-packed webinar, so we want to make sure that we get enough time for the speakers who have graciously given us their time. We will stay at the end for about 10 minutes at the end, the close of the webinar, to answer any questions. You can put questions in the chat and we will give you our emails. You can email us questions. And as always, we're happy to talk to anybody about the work we're doing and the work that GAPS is doing. So Pat, we'll let you talk.
Okay. Thank you, Chris. Can we go to the next slide, please? Actually, the next slide would be great. Okay, I would like to also welcome everyone and start with this. Ask yourself the question, why are we all here today? Well, I like to talk about the why. 41%. 41, if you look at that number, 41%, what does that mean? Black women have a 41% greater mortality rate from breast cancer than white women. That's like horrifying. And it's unacceptable. So what can we do about it? The Minnesota Breast Cancer Gaps Project believes that getting Black community members and healthcare partners together to create and deliver innovative breast cancer prototypes using a community design model is one way to do that. So what is community co-design? Next slide, please. This is a community co-design prototype that we use, and you'll notice there are 4 phases. I'd like to walk you through those 4 phases. The first phase is idea generation and seeking and surfacing ideas in a group to generate energy and enthusiasm. Phase 2, to put together a prototype, an early template or a model of what could be done. Phase 3 is to take that prototype and test it in the community, test it within the healthcare system. And the 4th phase is rollout and diffusion. And that's taking that tested model and diffusing it across the community. I'd like to point this out. Design thinking is very different than a project or a pilot. Many of us have done projects and pilots like forever. But in this case, instead of planning in the prototypes and then doing, the prototypes you do, and then you plan, and then you have a small scope prototype, and you take what's happening in the prototype, you build on it, you listen to it, you learn, and then you pivot in real time. That's what's happened in these prototypes, and that's the energy that's in there, and I wanted to share it with you. The next slide, very briefly, but most importantly, are the GAPS guiding principles. What does the Minnesota Breast Cancer GAPS Project strive for? Lived experiences, that's the focus. Lived experiences of Black women. Innovations inspired, led by, and sustained by Black women. The process, it has to be equitable, inclusive, and transparent. We want to have support from existing networks and program organizations. We don't want to replicate, and we don't want to replace. So that's really important. And the last one, critical, intentional action by creating the prototypes that are then replicated by community groups and healthcare. And that is the key, that you deliver what you promise. So these core principles are embedded in everything that GAPS does, including the prototypes you'll hear from today. And so I'm excited for you to hear our presenters to talk about the prototypes. Chris, could you please introduce the first presenter?
Certainly, I would love to introduce the first presenter, who is Natasha Hollowell. She is an RN at the Minneapolis VA healthcare system and a GAPS co-design member. She was also one of the speakers at our first Live, Laugh, and Learn. It was a community party with over 100 participants to really talk about and educate about breast health and mammography. So Natasha, let's hear what you learned about that.
Hi, everyone. Can you hear me?
Yep.
Yes. So I'm Natasha Hollowell, and I did attend the Live, Laugh, and Learn project community event. It was amazing. I feel like that project was, or that event was just what was needed for the women to be able to communicate and to come together, gather together for it was a serious conversation, but it was made to be fun. And sometimes we need that. I felt like it was very nice and welcoming. It was a warm environment, and everyone was able to communicate and ask questions as needed in that setting. Again, they were able to get their questions answered. People had questions even after we were getting ready to leave. People were asking questions, and a lot of people were able to go on to be screened after that. Sometimes when we're talking about being screened for breast cancer, people are afraid, but I feel like the Live, Laugh, and Learn event was just it was just a very warm and welcoming event that allowed women to be comfortable with asking the questions that they needed to ask, and having that idea of, hey, we can go get screened. It's not as bad as we think it is. Being able to see the videos of how easy it is to be screened, and not be afraid. So that's what I took from that. It was kind of a semi-informal event for a serious conversation.
Thank you, Natasha. I appreciate that. It really was a fun event. And we partnered with the Minnesota Spokesman Recorder on that. So next, I'd like to introduce Tessa and Alondra from Neighborhood Health Source. Neighborhood Health Source is a federally qualified health center. They have done a project with us, a prototype with us, to increase mammogram appointments. And it was a project that included a custom image, which you see here, closed caption videos in both Spanish and English in the lobby, flyers, postcards, and emails. So Alondra is going to talk a little, and Tessa are going to talk about the work and what they learned from it and what we've learned from it. Tessa?
Say thank you again to everybody for having us here. And I'm sorry, now it says I'm muted, but I think I'm not. You can hear me, right?
Yes.
Okay.
Yes, we can.
Okay. So we are a federally qualified health center, and we're in 3 locations in North and Northeast Minneapolis, and 1 in Coon Rapids, which is important because it's a different county north of us. And our population is about 24% uninsured for our patients, and our mammogram rate right here has been right around 33% in 2022 and almost 34% in 23. And so we've been working at different efforts, and we do not have mammogram on site, but we have both, we can certainly refer people to we do often refer people to other places for mammograms. And then we hold, Alondra has developed actually 2 monthly events now in which one where we bring our whole mammogram party to a mammogram provider, and one where a mammogram van comes to us. So we have 2 events each month where we try to fill our patients into those if there's any sort of barrier, or if it's just easier than trying to go to one of the mammogram sites that are not owned by us or not part of us. So we know that we have a long way to go with getting our mammogram rate up within our clinic for patients. And so that's why we were excited to do this project. And then Alondra is our community health educator. She's also a MNsure and insurance navigator, but she's a community health educator as well who leads this project for us. So I can turn it over to her to describe kind of how the project worked.
Can you guys hear me? Thank you, Tessa. So my name is Alondra Manzanares, community health educator, the lead in the cancer section. So we did this project with GAPS, with Chris and Pat, and then we didn't know what to do. So we were like, what do the community health workers know best to do is to speak out, outreach events and, be out in the community. So we did, this like little post-its that we showed in the screen. So we did them in English and Spanish, and we also posted this on social media. And then we went out in the community and then just posted it at some locations to see. And then we waited like a month to see what like the feedback was. And then we did get, I feel, pretty much a good impact. We have the particulate band come to our clinics, as Tessa mentioned, once to each clinic every month. And the spaces have been filled. So it's bringing something good. And also for March, we actually have 4 mammogram events that we're gonna do. So I feel like there was a good outcome. It is stressful or anything, but I do get the joy that these women they're getting an education, and they will get these preventative screenings, because the goal for this was for women, and especially people in the Black community, to know that it is their right to get screened, because they deserve all of this. So I feel like that's what we learned. It motivated us, and like just to keep going. And then we did not change every person's mindset, but we are trying to advocate for like all these women with this. And then we will just keep going. We have Chris mentioned how we can keep these going on for the future, which is good, so that we could, advocate for all these people.
And I want to add in a little too. Our community health staff is large and diverse, and we really appreciated that Pat and Chris the GAPS project brought the videos to us and said, like, what do you think? And we were able to share. We have some African-American community health educators who did really do kind of a review of the materials and gave edits and responses to the postcards and to the visuals and all of that, so that we could kind of say that we trusted that it would be something that we wanted to use in our community. And then another piece that was exciting about it is they were able to develop different links from the different sources all to the same video. So we could see, like, do people go to the video more often from a poster or a postcard or the text that it went out with? That was really helpful. And it was helpful too, just to think through, oh, we could have a video showing. And then Alondra was like, well, but people would just watch it on their phones. And we were like, oh, right. Like, people sit there watching videos. We don't need to show it broadly and be it loud in the lobby, so there was a lot of pieces that we were able to talk through about how our patients would actually use it. What would they actually do to see the video? That was super helpful that we got to experiment with through the project.
Thank you, Tessa and Alondra. That was great. And it was a really fun project. And we also had the things that the picture that you saw that we had done by a Black graphic artist. So we wanted to make sure it really resonated with the images of the community. So, and we can tell you more about that if you have any questions. So thank you, guys. Next, I'd like to ask Pat to really talk about a complementary prototype that went on at the same time.
As part of the NHS prototype we worked with community television outlets throughout North Minneapolis. So a 30-second video was created, and that video was shown with, had the same graphic image that you saw on the postcard that Alondra held up. So the same graphic image was in this 30-second video as on the postcards and the posters that were used. And the call to action across these TV outlets was knowing is better than fearing. Get a mammogram. And so on this slide, just very quickly, I want to describe results and lessons. The reach was 16,000 some people in North Minneapolis, and you'll see where the top location was North Market and Delhi. It's got high traffic, long hours. And then fitness centers and hair salons followed in order of reach. And really, this is so cool. The most viewed message was watch Natasha share what happens on the day of the mammogram. So Natasha talked to you earlier about the Live, Laugh, Learn event. She's also in the video, what to expect in getting a mammogram. And that message about watching her share what happens on the day of your mammogram was a huge hit across the community TV. Some lessons for next time it's done: create a companion article, local media, put posters with the QR code in the windows of the locations, social media posts, develop with single keywords, and then to keep it really simple. We tend to sometimes on social media, a bunch of messages together. And what we want to do is make sure that those messages are separated. So that is a quick summary of the community TV outlets as part of the Neighborhood Health Source prototype. Back to you, Chris.
Great, thanks, Pat. This was also done with our Minnesota spokesman recorder contact, who has been working with us for 2 years. Next, I'd like to introduce Mara Mendoza. She is a DNP student at St. Catherine University, and she did a prototype up at Brooklyn Center, Hennepin Healthcare. So Mara, take it away.
Hi, everyone. Thank you. You can go to the first slide. Hi, everyone. My name is Mara Mendoza. I'm a Doctor of Nursing Practice, or DNP student at St. Kate's. My DNP program culminates with a quality improvement project, which I'll be sharing briefly with you all today. It's titled Improving Mammogram Rates in Black Women at a Local Primary Care Clinic. So feel free to go to the next slide. My quality improvement project aimed to increase mammogram rates in age-eligible Black women due or overdue for mammograms at a local primary care clinic, which was Hennepin Health, Brooklyn Park, by using a set of community-based education videos produced by the GAPS Project, which are created by and for Black women that address sociocultural fears surrounding mammograms. The videos were shown in 3 settings to maximize engagement with the content via MyChart, messaging, in the clinic, and in the community at a local public library. The most significant portion of the project was at the clinic, where the videos were shown to women during the rooming process for office visits on iPads that were actually provided by the Breast Cancer Gaps Project. So the hope with this is that these videos would help Black women feel informed and empowered to get screened and to share the importance of screening with their loved ones. As you can see from this abbreviated timeline, I've been working on this project for well over a year now, and we are coming to the end of my time with the project. I'm currently in the process of analyzing all the data I've collected and preparing it for dissemination, such as presenting it at a national evidence-based practice conference in April. However, because I'm still in the process of analysis, I don't have finalized data to share with you all today, but I do have some preliminary data. Next slide, please. Here's a graph of all the mammogram orders placed by provider in the year 2023. In pink are the mammograms which were ordered and then completed by the patient. And then in gray are the mammogram orders that were placed but never acted on or completed. Now, this can be due to a variety of reasons, some of which were out of the scope of addressing with a DNP project, but in my research, I found that there can be certain fears and misperceptions that may exist due to specific historical and sociocultural contexts of Black communities that might hold women back from getting screened. So this is where the educational videos come in. And as you can see, I began my project in late October, and without having the formal analysis finished yet, there's a clear increase in both the number and percentage of completed mammograms from November to December. This could be due to my project or maybe some other factor, but the point of this quality improvement project was not to identify why there's a change, but rather what is the change, and to explore that change and help it and support it in occurring. Next slide, please. This is the other preliminary finding graph I'd like to share today. Once again, you can see along the bottom axis is time, but this time it's divided up by quarter instead of month so that we can take a peek back 4 years. And then along the left side is the percentage of ordered mammograms completed for that quarter. The average completion rate over the past 4 years was about 45%. That's that dotted purple line going horizontally across. And as you can see, going from Q3 to Q4 in 2023, which is when my project was being implemented, there was an increase in completion rate, and both of those quarterly percentages are higher than average, which is reassuring that my project might have had an impact. One funny thing you might notice is that there's not a single mammogram completed in Q2 of 2020. You'll remember that in March 9, 2020, we had the national shutdown and state of emergency declared for the COVID-19 pandemic, when the majority of healthcare shifted from preventative care to emergency response. So nobody got screening mammograms done then. In both this graph and the last one, you might have noticed that there's a placeholder for January 2024. That's because that data is still pending. When a mammogram order is placed, the patient has 3 months to complete it for it to be recorded as completed. And therefore I'll have January data in April and can finalize my graphs and really take a look at my project then. If you're interested to see, the mammogram completion rate and watch it hopefully continue to rise, I will be sharing that information with Chris and Pat, and I'm sure they'd be more than happy to distribute that when the time comes. Next slide, please. Finally, I just wanted to share a few pearls of wisdom I gained in the process, because while I don't have finalized data, I do have some finalized lessons learned. So the first is creating change within a healthcare system, whether it be Hennepin or any other system, is very, very challenging. I've learned that quality improvement work takes time, patience, perseverance, and good communication, as well as flexibility, because the process can be very unpredictable at times, such as recently when the Brooklyn Park Clinic mammogram machine was unexpectedly out of commission for longer than we expected, as they were updating it to a 3D model. But you do your best to adjust and move forward. I've also learned about the importance of community partnerships in doing this project. My site mentor, Brenda Kennelly, who's on this call today, is the manager of the Hennepin Health Brooklyn Park Clinic. And she has a long-standing relationship with Chris and Pat in the GAPS project, and it is only with her championing advocacy did I have the successes I did with this project. Finally, even if I get my data analysis back and I don't have statistically significant results, I've learned that with quality improvement, statistical significance is actually not as important as clinical significance. We have a few more meetings and debriefs to do as a team, but in my opinion, this project has had positive clinical impacts, and therefore I want to end with posing the question, where do we go from here? The possible future directions with this project and other partnerships between the next cohort of St. Kate's DNP students, the Hennepin Brooklyn Park Clinic, and the GAPS project are endless. The sky is truly the limit. Next slide, please. I just want to give a quick shout out to Brenda, Pat, Chris, and Dr. Vareka for supporting me through this. Thank you all for listening to me today. Hopefully you learned something new or feel inspired. Feel free to reach out with any questions, and thank you again.
Thank you, Mara. You're right. Predictability and unpredictability is sort of a hallmark of a prototype. And that's why it's really important when we do these prototypes that we think about how can we pivot and actually make it happen. So we know we had lots of conversations about even getting the iPads up and running, but it really has some great information that we will make sure it's available to all of you. Now I'd like to introduce Tom Noon. Tom is a principal financial analyst at Blue Cross and Blue Shield of Minnesota, and he actually was on our Men Matter team. And our Men Matter team was the team that came together to look at how can Black men impact Black women's health, particularly around getting a mammogram. So Tom's going to talk a little bit about the Men Matter team and the project, and then we will premiere our Men Matter video. Tom?
Good afternoon, everyone. My name is Tom Noon. Very proud to be part of the Men Matter team and part of that work group. It's especially important to me. My mother had breast and ovarian cancer, and I lost both of my parents within a 4-month time span in 2021 to cancer, and so it's just been very impactful work to be a part of, and being amongst a group of men, and being able to kind of share stories, share experiences with having conversations within family, reaching out to friends and family within our networks, and gaining learnings and things from our networks, and coming back and compiling that information as we look to develop prototypes and ideas for the purposes of having these conversations, as it's critically important given the fact that the health outcomes and the disparities that exist. It's really important that men take it upon themselves to really, where possible, have those courageous conversations with the women in their families that they love. And so with that said, one of the prototypes that came out of that work was this video that will be debuting today with Phil McGraw, a fellow Men Matter team member, as well as his Aunt Sharon. And I think the video is amazing. It really illustrates the importance of having these conversations with the women we love, and our role as Black men in the family, can play a huge role in having those conversations and about breast health, and getting more of our women to get those mammogram screenings. So with that said, I will turn it over, and we'll take a look at this wonderful video.
So this is the premiere. This is called Courageous Conversations About Breast Cancer. And we had Philip McGraw, who is a member of the Men Matter team and has also done some video work for GAPS Project, and his Aunt Sharon have a conversation. And this is that conversation about how men matter too.
So tell me, how did you feel when I told you I had cancer?
You caught me off guard. I felt I didn't know what to do.
Really?
I didn't know how I should feel, what I should do. It was a caught off guard, kind of like, wait, like I'm powerless. Like, how can I help you type
Right.
of thing. I remember that conversation like it was yesterday. I knew exactly where I was. So it was one of those moments where you know exactly what you're doing when you broke the news to me.
I'm so glad I told you, because we don't really talk about it. We don't talk about breasts. How did it actually help you as a man? Do you talk about it? Do you share with, how your girlfriend? You got a daughter, my niece, do you talk about it?
The first person I thought about was my mother. Mm-hmm. It made me realize we're not immune, and we need to start having conversations, those uncomfortable conversations that we didn't grow up having. Mm-hmm. But when I was asking her questions, it was more of no, I'm okay, or I need to research. I need to research about the testing, because I don't want this or this person probing me, or I don't trust them, or I'm okay. Right now, I don't feel anything.
That's my sister.
Yeah, but for me, I you know, so if I have to be the bad guy or whatever, and I was respectful, but I was just
Right.
like, Ma, you know, why don't you want to get tested?
Right,
You
right.
know, enough is enough. Like, you know, your mom, you know, like the multitude of people that we know who are
Right.
sick, passed away, Ma. You see what's happening on the news.
Right.
Like people are, we shouldn't hide it. Our community, our Black community, we shouldn't have to hide it anymore.
Right.
We have too many disparities.
That's right.
Point blank, we have too
That's
many
right.
disparities. Let's change it, man. Like you could change so much in my life.
Mm-hmm.
You know, I'm pleading to you. I love you. You know, can you get tested? But I know you stepped through and you had a more powerful conversation with her.
Right,
So
right.
what was your conversation?
Well, you know me. I straight between the eyes. Girl, have you got tested yet? When the last time you had your mammogram? Okay. It's just like, oh, I had an appointment. I made the appointment. I'm going next week. I call her up.
Good.
Dad, when's your appointment? I rescheduled it. Okay, look,
Yes.
you have to promise me that
That's
you're
her.
gonna do that, right?
That's her, yes.
So she rescheduled it probably 4 times. In fact,
Is that fair?
as of today, I don't even know if she really went.
Okay.
So I'm gonna call her and be like, Dad, have you gone? It's really hard when you know that someone has information presented to them, but they won't do anything with
That
it.
is very mind numbing.
So I challenge you, okay? I give you a challenge. Me, I'm going to do more with the older generation
Okay.
and talking about breast cancer. I don't care what man or female, I'm gonna do better. That's what I'm gonna do. What are you gonna do? I challenge you.
You know, I'm gonna get some more information. Obviously, you are a testimony. You're a living testimony. Like things that I had to feel, like I felt hurt. You know, I felt pain inside, and I want to start talking to the people that's in my circle. Mainly, man, my brothers.
Okay.
My friends that I know. It's important.
And step out your comfort zone.
Step out of the comfort.
Step out
Step
this-
out of the
yeah,
comfort zone. It's
absolutely.
important. And just like you alluded to, you said it. Go straight at it. You know, show them that you care, you love them.
Right.
And you're saying it because you do love them.
And it's real.
It's real.
It's
and,
real.
and you would hate to not say anything. You had the information
And not share it.
and not share it to someone.
That's right. So that's a challenge.
I got you.
All right.
I got you.
Thank you for watching that video. When we showed it to the Men Matter team, they very much appreciated it and thought it was right on. So we would love to hear what you think about it. If you guys could, if you're willing, just put a comment in the chat so we can gauge how you viewed it and what you thought about it. This project is a prototype right now, but in this next coming year, we're going to be looking at using it as an educational moment with African-American men's groups with some kind of a education guide, a toolkit to go along with it. So that's where we are with the prototype for Men Matter. I'd next like to introduce Whitney Terrell, who is our strategic direction coordinator, our coordinator, consultant, and all around knows everybody in town kind of person. And so she's going to talk a little bit about what she's learned in some interviews that she's been doing in the community for us. Whitney?
Hi, good morning or good afternoon, everyone. I'm really happy to be here, and thank you, Pat and Chris, for letting me join the project. I'm really excited about some of the interviews that we've been really privileged to work on, and some of the initial results of the interviews are really centered around a collective impact approach, trying to connect with different leaders, many of you on this call, and some of the ways that we can try to hold the weight of disparities facing the African American community, our community. And I've been really privileged to start working on meeting with a list of about 20 leaders. And the initial interviews and results is what I hope to share today. And much of that will be used to inform a strategic direction or directions that will be shared back with you all. So some of the first learnings are some of the 6 themes here that I'd like to share. So one of the first is creating an approach that cares for, sees, and believes us as Black women. And the approach for the interview is kind of backed up from looking at what is like a person's why, and then going all the way back to overall Black community health. But one of the main things that I kept hearing repeatedly in the initial interviews is that we are believed and that we're seen by the healthcare system, and that in general, planning must include, from conferences, events, must include us. We also really want to increase access to care when needed. So as you know, has been described, for example, in the video of Phil and his aunt, is making sure that our systems are responsive to Black women and our community when we have an interest in getting that screening, that it's available, and also that it's really responsive and culturally appropriate care. It's accessible whether or not someone has insurance. One of the other really challenging parts of the interviews included trying to honor Black women who are lost to breast cancer, and thinking about the importance of early detection because of that first statistic that hit most of us, that 41% of us are more likely to die as compared to white women when we're facing breast cancer. So I really felt like there was this deep sadness in some of the conversations because of women that we know or who we almost lost to breast cancer. The other thing is that we tried to include this conversation around wellness as a vision for the Black community, and trying to think about how might we interrupt patterns that do not serve generational wellness. So we don't want to just be focusing on detection or prevention, but really want to get to that overall wellness. And there were so many wonderful comparisons within some of the conversations around what does that look like for African Americans or like Black Americans generally, and then some of the ways that culturally we could be like wrapping more around each other from a cultural perspective, and then also thinking about our diet, our food, just really making sure that it's normalized for seeking out both wellness, prevention, and detection for breast cancer and other barriers to overall wellness that's facing our community as a whole. And then the other parts that we many of you shared were around a system that actually includes and supports us. So we don't want to just be the patient. We want to be the provider. We want to be the public health professional. And that as people are leading nonprofits or other spaces related to addressing breast cancer for Black women, or you know, other cancers or disparities that we have, that there's appropriate tools and care and information as needed. And the other kind of final thing is just that we are consistently raising awareness. And so as like Breast Cancer Gaps is raising awareness, another organization's raising awareness, it's a consistent message and conversation, so that many of us as Black women, we will not forget that we need to focus on our screenings. And then hopefully these other campaigns like Men Matter and these conversations, that others will kind of fulfill their role, will fulfill our role in kind of keeping each other healthy. So consistent messaging was really important too. And I just look forward to sharing out as we're completing additional interviews, more themes, but these are just some of the initial kind of ways I would capture some of the initial feedback. Thank you for everyone who's been contributing.
Thanks, Whitney. I'm going to turn it over to Pat, and she's going to talk a little bit about next steps, and we will have time for Q&A at the end. Pat?
Thank you, Chris. I would like to also thank Whitney and my gratitude too to Natasha, Tessa, Alondra, Mara, and Tom for their leadership and for their commitment to their prototypes, and no small thing, sticking to their time on the agenda today. It was great. Thank you all. Appreciate you. Let's talk about the people on the call right now. I have 2 chat questions I'd like to ask everyone. And if you could contribute, this would really be appreciated by the presenters today, because we want to look at this information. So if you could respond to the first question in the chat. What was the one most important thing that you learned during this webinar? If you could dive into the chat, we'd appreciate it. Okay, is everybody typing? I love chats. Okay, let's, as you can still keep typing, and I'm gonna point out some of them. Jessica, it made you curious to see the completion rate among various races in our own healthcare system. This is good. Learning about what GAPS has done, and we really wanted to share that with people. And we loved having Philip share his experiences, and with the whole point of having young Black men be more comfortable in talking to the women they love about breast cancer. Community engagement, resources, lots of kudos to Tom in the video. And I think that it is all about collaboration. It is about working together, like with Neighborhood Health Source and with Brooklyn Park Clinic. And right, people working on the disparities gap are the people that should be driving the work and should be part of what's happening. It's all about engaging people and having good conversations about breast cancer. And it's interesting that one of the things that stimulated this project with men is that we looked at social media outreach the year before, and the majority of the people responding on social media to the breast cancer stuff were men. And then we went, boom, let's do a video. Okay, so you can all see the chat. I'd like you to now, if you could, respond to that second question, because this is really important, again, to the presenters to see that the testing of their prototypes is going to be acted on. So if you could just dump the bad word, could you please type into the chat how you will act on the information from this webinar? And what will you do when you get back to your work? Is there something that you could actually act on? So if you could put that into the chat, that would also be incredible. Supporting health and supporting collaborations in the community should be a health insurance goal. Engaging with the community, expanding dissemination of Natasha's video. Yes, that's good. that is one popular video, and it's just great to see that. Sharing it with other Cancer Alliance folks and sharing it with people you know within your networks. And I think that's really good. I also think that one of the things that has been really important from day one from the GAPS project is that connection between community and healthcare, that it's got to be together, and it can't be driven by one or the other. Sometimes you have to work collaboratively. So that, I think, is just huge. Riona is saying that she can share the information as you recruit breast cancer patients and increase navigation. Fabulous. And continuing to engage with the community. So you can keep typing, but we really wanted to see what you thought. And like I said, our presenters also appreciate it. Okay, next slide. Okay, in addition to Natasha's video, where there are other videos that the GAPS project has, and they're on the GAPS website. That's the key. If you look at the last checkpoint there's the GAPS website link. So what do we have here? We have 14 community videos. They aren't slickly produced. They feature lived experience, Black women, and the topics in these videos are on what is breast health, mammography myths, what to expect we know about during a mammogram. And you'll see the women in the strip on the bottom of this slide. Those are the stars in our videos. So wanted to give them all a shout out, small one, but a shout out. And a lot of the videos, they're produced in shorter versions for social media. So that's also, you're able to access that on the GAPS website. Okay, next slide. If you have questions, here's the contact information for Chris and me. It was also, I believe, in the chat. One of the things I want to do is talk about a call to action. So all the prototypes you heard about today have been tested. Should your community group or should a healthcare organization, should you be interested in replicating what's done within your organization or community group? We invite you to Zoom with Chris and me and maybe some of the other people on the call today to talk about how to do that. So that's why we want to make sure we share the contact information. Also, look for an email. This is pretty typical. Look for an email after this with the webinar recording, because we know some people at the last minute could make it, so we can send them the webinar recording. You'll get the men's conversations about breast cancer video and probably a quick evaluation question. So that'll be brief. Okay, next slide. This is my gratitude slide. I love this slide. So who are we gratituding to? We want to honor the voices and action within the Black community. And this kind of happened without the community working on the prototypes. We appreciate Blue Cross Blue Shield of Minnesota for their ongoing support and cheerleading. And we thank you for joining us today. Next slide. Okay, so here is something that we would like to offer. We know that this agenda was jam-packed, and we all talk pretty fast. So Chris and I and the presenters that can do it are going to stay after we close the official webinar for 10 to 15 minutes. If anybody wants to stay online and chat and ask questions, we would absolutely love it. So that is where that is at. And before we go into that Q&A, I am going to just give you one last message, just one message. And that message is, together, we will change the 41%. So thank you.
Thank you. I just want to pipe in with Pat and what she was talking about. The videos on our website, you can download. They're either on YouTube or Vimeo. If you'd like a whole set and more information about the videos, please reach out to us. If you're going to use the videos, please let us know where you're going to use them so we can track how where they are used. we talk about the what to expect video or watch Natasha share who presented to you. That video is now used in a lot of different areas, and it was also used both at with the Brooklyn Center, Hennepin Healthcare Brooklyn Center, and the NHS prototypes. So with that, Pat, what's going to be the best way to take questions?
I didn't know if you and Rob had, I didn't know if you and Rob had decided to tile it or to just open it up.
Let's just open it up. People can turn on their cameras if they want. And we can either take them through questions or through chat. So if you have any questions, just let us know or shout it out. Whatever you want. No questions? Oh, you don't have the ability to speak. Just turn your microphone on.
Can you hear me?
Yep.
Hotep, everyone. I don't have a question, but I just want to share with those who were a part of this, if they are still there, my appreciation and gratitude for all the time, effort, and work that they contributed to making this possible. All of the information for those who have limited knowledge about breast cancer, and in particularly with African American women. This is a wonderful source. And so also to Pat and Chris, I want to thank you for your diligence and moving this forward. So it was wonderful. So thank you.
Thank you to Dr. Ora.
Are there any other questions? Or comments? I see that we have a message in our chat that says, please raise your hand if you would like to speak, then I will unmute you. So everybody, if you want to do that, just raise your hand. We still have quite a few people online. Chris, are you still there?
I'm still here. Yes.
Okay. So why don't we do this, since you're not seeing hands raised from over there. I can't see that from here.
Nope. We're not.
Okay. Okay, so what I would like to do is just open this up to the presenters to see if any of you have anything that you would like to share at the end. Don't volunteer all at once.
I can start. This is Mara. I'm the DNP student with St. Kate's working at Hennepin Health. I wanted to just point out something I didn't have time to cover in my brief 7-minute slot that I was given. I did, as part of my project, also have surveys that I administered to the women who were watching the videos in the clinic. And while I haven't had, like I said in the presentation, I'm kind of still digging through all of the data, but I'm excited to have a little bit of qualitative data in addition to the quantitative. So the quantitative being the number of mammograms we're getting, the completion rates, the percentages, that's all great data, but equally as valuable is the qualitative data. Hearing about women's reactions to the videos, what their beliefs, knowledge, attitudes were before watching the video and after, whether they're planning to share it and how they're planning to share it. So I'm very excited to kind of dig into that set of data as well and incorporate that as part of this project and share that with the GAPS project, with Hennepin, and hopefully use it to kind of make the next step of this project more impactful.
Anybody else of our panel? Just a quick note, Natasha, you'll like this. We've already scheduled our next Live, Laugh, and Learn. I think it's September 29th. No, we don't know the location or anything, but we did decide to put a marker on the calendar and say that's when that one will be, and possibly hold one in Minneapolis and in St. Paul.
This is Whitney. I just wanted to acknowledge some of the comments in the chat and to say thank you and back to everyone in the chat. There's some people who are part of the interview round, so I'm really grateful that you were able to be here too.
Okay.
This is Natasha. That's great. I'm excited about that. So I will put that on my calendar to hopefully be able to attend that. I'm excited about that. I'm really excited about the numbers of people that were able to, that we were able to reach with all of the information that's out there and the videos. I really enjoyed the video with the young man and his aunt. Because sometimes those are the tough conversations, and I think that should be covered as well as, you know, what happens after you find out and who you have to tell and how do you tell them and how do they feel when you tell them. So I think that was great to see that video.
And I just want to say thank you for all of the feedback and comments, and then just thank all the presenters and everyone that's involved in the initiatives and the great work. It was very, very, very informative.
Pat, I think we're good. We will be sending out an email early next week. It will include, as we said, the recording and links to our website and the videos, so, and our contact information. So thank you all very much.
Thank you. Have a good rest of your day.
Thank you,
Thanks.
you too.
Thanks, guys.
Thank you, everyone.